I'm Dr. Kelsey Betcher here at Elevate Sports Performance and Healthcare. I am one of the chiropractors on the team, and I'm here today to talk to you about an injury called a stinger. Now, a stinger often happens in contact sports. We see it a lot in football. It can also be seen in hockey, lacrosse. It can be seen in many sports, but right now, this time of season, I know I'm seeing a lot of it on the football field. So what happens? What is a stinger? Well, a stinger is when the neck and shoulder get violently pushed or pulled apart. And what happens is this nerve structure that goes from your neck to your shoulder, called your brachial plexus, gets stretched really hard and really forcefully, causing irritation to those nerves. And as an athlete, you get a sharp electrical sensation that goes down your arm. But it's not always that. Sometimes it can just be burning or tingling in the arm, or sometimes even all the way to the hand. But a lot of times you're experiencing this nasty kind of sharp electrical sensation down the arm, and it's because those nerves just forcefully got pulled apart, causing a lot of irritation and then referring that pain down the arm. So sometimes referred to as a stinger or a burner, and we see it a lot with tackling, because with that tackling mechanism, you're going after someone and getting those neck and shoulders pulled apart, and then bam, that stretch happens, and bam, that stinger occurs, okay? But don't be alarmed. It can be really scary if you've never had it happen to you before. All of a sudden you're getting this weird arm symptoms, but take a few breaths. If you're able to get off the field, get off the field, but those symptoms should dissipate relatively quickly, okay? They shouldn't be lingering too long. It might only be something that you experience for a few seconds. It could be something that maybe you experience for a couple minutes, but it shouldn't be lasting too much longer, okay? Usually we see those symptoms reside really, really quickly and have kind of full, bam, they're gone now. I just had that one ouch, shooting style pain down the arm, but hold on, a couple minutes later, it's completely gone, okay? Sometimes it can present as weakness too, but of course with these contact sports, we gotta make sure that other injuries don't happen as well, okay? So with that tackling mechanism, we gotta make sure that the shoulder itself is okay, the AC joint is fine, the rotator cuff muscles and tendons are okay, and we certainly got to make sure that the neck is okay, that there isn't any significant strain or sprain going on in the neck, as well as disc herniations, because disc herniations can present with some similar symptoms. So if you have symptoms that are lingering or staying around, or just really, really intense pain, you should not be going back into the game. You should only return to play if those symptoms are completely gone. And of course, if things are lingering a long time, we got to get you in and get you checked out and make sure, as I mentioned before, that a serious injury has not happened. Something more severe, you know, talking about those discs, that shoulder, making sure that all those structures are okay. But even so, if there's still some tingling and some periodic stuff in your arm, how can we treat that? Well, one, your nerves, we can work with the nerves and help them kind of glide a little bit nicer, help take off some of that irritation to them. So we can do some nerve glide exercises. We can decrease tension to those nerves. We certainly need to make sure we have full range of motion in the neck and in the shoulder. And then we got to work those muscles, because you also have some muscles that lay right over that nerve structure. And if there is an injury and your body's guarding, those muscles can be hypertonic, they can be tight, as well as just kind of spasming over those nerves. So important that we get the tissue work done too, to help take that irritation off that nerve plexus to get you back to where you're at, okay? But if this is something that happens on the field, especially if you are a tackler tackling someone, take a few breaths, get off the field, kind of assess. I know it can be scary, but those symptoms should go away if it's our generic stinger style injury, okay? So again, with shoulder and neck being forced apart, that adds a lot of tension to those nerves, and it can send kind of those zapping symptoms down the arms. But they should go away relatively soon, and if not, you know who to call. Get an appointment with us and we'll get you fixed right up.